Hi, I'm Jeremy Cardon with my brother Jonathan Cardon, and we are the practice owners of Clocktower Family Dental. And I want to emphasize the family part because we are brothers.
We are brothers. If
And
anyone's wondering, he's older, even though I look older.
I definitely am older, 5 years older, almost six, right? And it's been fun to see, kind of how we grew up together, and now we're business partners. But we started off going to the same school there in Philadelphia, and it was my dream to become partners. I don't know if it was your dream or not. It may have
No,
evolved into a dream, but
it turned out that way. In fact, I wasn't even interested in dentistry, even though he was trying to talk me into it. He was a couple of years ahead of me in school, and he kept trying. I was in engineering, and I said, I don't want to spend the rest of my life with looking at someone's mouth. And then I met my wife at the time, and she had family that was in the dental field, and of course she was able to talk me into it. So turns out it was a better fit for me than the direction I was going, because it's just a more natural fit for my personality, it being detail oriented and those types of things. But long story short, yeah, we both went to dental school together. He graduated a couple years ahead of me. I was in the military. He was in private practice, and never thought we'd be working together. I lived on the East Coast and was finishing up my military commitment and was looking into purchasing a practice, and he had just bought one and was kind enough to invite me out here to look at it. And of course, we always have questions about how it's like, what it's like to work with family, and we've definitely had our ups and downs, but it's been way more positive than I could have imagined, and it's been a great experience for us. So we've been practicing together the last 10 years.
yeah. And for my part, I never practiced as a solo practitioner. I always practiced as a group practice until I bought this practice, and I was solo for a year and a half, until I twisted your arm to have you come back out here. But from my part, I don't think I could have a better dental partner. So I've been really, really fortunate that we've been together. And a lot of people call us the two sides of the same coin, which is nice. And so we do have definitely our differences in how we kind of approach things, which can obviously cause some friction. But we also have a lot of things that we share in common. Obviously, from a patient care standpoint, from even to what we want and desire as a business, and those things that makes us such good partners. But can you speak to the two sides of one coin?
Yeah, I think we're complementary in that we are different personalities and how we view and how we approach things, like you said. Even to the way we practice, he focuses his practice more on Invisalign therapy and TMJ and sleep things. Those are his passion, which mine are different. Mine more revolve around comprehensive dentistry. That's the way I was trained. I did a residency in the military, and very much the focus was on comprehensive care dentistry, and that means kind of taking care of needs A to Z, a lot of reconstruction, that type of stuff. So we definitely delve into different things, have different things that interest us, but that's complementary because those two aspects of dentistry are interrelated. And so we'll refer back and forth to each other as far as patients who have specific needs. I'll say, hey, what do you think about this? And vice versa. And so that's been really helpful, not just from a business perspective, how we view things differently, but from a patient's perspective and how we approach dental care. We feel that we're able to provide a much more comprehensive level of care to patients based on our interests and how we view things.
We spoke a lot about that collaborative care, and obviously we work very well with the specialists here in Castle Rock and the surrounding areas. We feel like that's a big part of our practice, to work with those specialists and collaborate with them. But you also spoke that we really collaborate very well with each other and our different interests in the dental community where we can, work with one patient that might need a little bit different disciplinary care and or interdisciplinary care, and we really work well together at those different aspects. So that's been also kind of like a little dream team as well, being able to work with you with solving some of these more complex dental problems.
Yeah, that's kind of fun to be able to see a certain set of problems that a patient may present with, and again, being able to take different backgrounds, different educational interests, and passions that we have, and interweave those and combine those, and obviously include our specialist partners as well when that's necessary. And again, being able to provide, again, I'll use the word comprehensive level of care to our patients is really where our passion's at.
And we've said a lot of this passion, and I feel like not only our staff and our patients can see that, but in whether it's family gatherings or vacations or whatever, we talk a lot about dentistry because we do have this, obviously love for the profession, and to the chagrin of maybe our families, we talk a lot about it. But that goes to show you that we have had a lot of extra education and have devoted a lot of time, effort, and resources into becoming what we hope is the best providers that we possibly can be. I know we joke that we have, if you counted up our hours of continuing education together, we've probably gone to dental school a few times over, just based on the amount of hours that we spend outside of the practice learning about dentistry.
Yeah, we definitely have spent a lot of time and money and resources in doing that, and it's because we want to be the best that we can be and provide the best care that we can. And that goes along with our team members who we are very fortunate to have. We couldn't practice what we practice without their care as well, and their passion for what they do, and being able to provide not just the best care but also hopefully the best experience. And that possible that comes down to how our team members interact and feel about their role and their jobs in our business. And again, we could not do or would not be where we are at with them. So.
And we also have, with that education, a lot of advanced technological features that we can offer to our patients, from intraoral scanners to extraoral scanners, where we can do a full face scan, a 3D scan to help integrate some of these specialties. We have laser therapies we can do that are all the way from bleaching to cold sores to periodontal therapy. 3D printers, milling units where we can provide a lot of same-day treatment to our patients. And so we've also been really passionate about providing our patients with the top technology that we can for them.
Right. Digital dentistry is one of my interests and, again, passions. We love to stay on top of the latest and greatest of what's being offered in dentistry, and there are times when it makes sense to integrate those technologies into our practice. There's other times where we choose to wait until the technology is a little more tried and true. But the fact of the matter is we love to stay on top of it and know what's being provided and offered and know where it's going. That's really exciting. And it's going in a lot of really cool, fun directions. And so, I truly believe it'll continue to get better and better for the patient. So.
And that's one thing that we want to promise all of our patients is not only can you come here and get some really amazing comprehensive care from both of us in what we do collaboratively, but also what we feel like is some of the best technology that can be provided through dentistry. And hopefully that our patients can see that and feel that, and also we can do it in a really comfortable, warm environment. Like I said from the beginning, we're a family practice, literally and figuratively. We want you to feel like you're part of our Clocktower Dental family. And we really hope to see you because, we really like what we do and want you to experience that and feel that.
Agreed.